Good evening. So my name is Owolabi, and I'm here to answer some of the questions that you have posed for me. Okay, so I'll just jump right into the questions. So the first question is that what is my honest opinion about practicing medicine in Nigeria? You asked for my honest opinion, and you're going to get it. So my honest opinion is that for now, practicing medicine in Nigeria is crap, straightforward and simple. Okay, so if you have an intention of practicing medicine the way you've been taught that medicine is practiced, then Nigeria is not the place for you to practice. But having said that, I don't want to discourage you. After all, you would ask me that why have I not left the country? Okay, that's because I don't have a chance yet. Okay, but it's not all bad. So some people are back, staying back and practicing the medicine, and in all of it, you still get opportunities to still practice jungle medicine and get to help some people. I mean, there are some things we do here that I'm sure that if the developed medical world sees us, they'll be like, wow. Do you understand? We still get the results. But honestly, I don't think practicing medicine in Nigeria now is the thing, especially for foreign trained medical students like you guys. Because I don't know when you're going to earn enough money to even pay back your parents their investments on you. That's the truth, okay? So, to the next questions that said that what is my honest opinion about foreign trained doctors? It's neither here nor there. I've met foreign trained doctors that are quite good, and I've met some that are not so good. I've met locally trained doctors that are good, and I've met some that are not good. But if I will speak generally, I think that for most foreign trained doctors, especially those that are trained in the Eastern Europe, that area, they usually don't get to have hands-on practice with patients. And so when you meet them, as I usually do, I meet them during when they are doing house job. So they tend to be lacking a bit in that. But the good thing is whatever they lack in skill, they make up for in zeal. So in the end, by the time house job is over, the experience evens out between the foreign trained and the locally trained. So would I want to send my child to a foreign medical student to train? Well, I don't even think any of my children will study medicine. Okay, so that's that. So the second question says that as a lady, my family and friends have been telling me to get married before I do internship and start specializing, or else it will be hard to get married when I start. Is this true? And how will you advise that ladies settle down in medicine? Well, for this question, there's no hard and fast rule about it, okay? I think you can do anything that works for you. I know that a lot of people imagine that when you start internship and you start residency as an unmarried lady, that it's unlikely you will get married. It's not true, okay? So, from my own experience, okay, so I have a colleague here that might have an opinion if I can convince her because I'm at work. Okay, but back to what I was saying. In my own experience, actually, when I got married before I started residency, but basically it was because marriage came along. So for as many of you that you have spouses or you have partners who are ready to marry, I'll advise you to marry. But if you are not yet married and you want to pursue your residency, just do what you want. If you trust God, whatever you want, you will get it. Residency doesn't affect marriage. That's the way I see it. It doesn't do anything about it. It just means that you do what you want to do, and with God's help and direction, you can have it all. It's possible for you to have it all. But if you are waiting to get married before you start residency and you don't have somebody else yet, I think you are wasting your time. Just live your life. Things will happen. Okay, so the third question says that how was it for me And is there any advice I wish I had back then before specialization? Okay, so for me, it's a little bit different in the sense that I didn't start residency immediately I finished medical school. I started quite late and had my family, had worked with the government before I went back to do residency. So the real reason why I went back to do residency was because I felt that I had wanted to do it initially. I pursued it, wasn't successful, I had left it. But I went back because I wasn't able to move out of the country as soon as I wanted to. And I felt that if you're around, you should make the best use of what you have. For any doctor that is staying in Nigeria, not planning to relocate, it's still your best bet to do residency because you need that knowledge. You need to constantly learn new things. So that's how it was for me. So was there any advice I wish I had then? Actually, the advice I wish I had then, I had it, but I didn't pay attention to it. Somebody advised me that I should concentrate less on clinical medicine and more on paramedical areas. Remember, somebody was telling me that I should concentrate more on some diploma studies that do not yet have a residency, like a postgraduate college. I didn't do that, but I wish I had done it now because, I don't know, maybe because personally I'm tired of clinical medicine. So my advice to you guys would be that don't just think of clinical medicine. Think areas of research, think paramedical, think artificial intelligence in medicine. Don't just think of the normal pediatrics, obstetrics. Think of robotics in medicine and how it can come to play and pursue things like that. Okay, so the fourth question says that what hurdles did I pass through as a lady immediately after my studies and how did I overcome them? So hurdles, well, as a lady, the primary hurdle I passed through was being an unmarried doctor in a private hospital setting and having everyone that comes in either wanting to date me or to marry me for their son. So that is one hurdle I passed through as a lady. And then the other challenge was trying to move ahead and having to deal with parents wanting you to settle down as a lady, basically. But in my practice, I didn't really have much hurdle. But in retrospect, I felt I wasted a lot of time. There were some things I could have done. I had some spare time that I didn't identify as spare time. I could have done some masters, taking those times to do some other things, and then they would have been done by now. So overcoming those odds was just simple. I just smiled at those people that were trying to hook me up for their sons, their brothers, their nephews. I just smiled politely at them and waited till God said it was time. So the next question is asking about what my main motivation in medicine was. So what is my main motivation? Why am I still in medicine? The first question is, why did I study medicine? I studied medicine because my father wanted me to study medicine, and then because I realized that it would give me opportunity to I love children and I love relating with children. So I felt, okay, if I was going to study medicine to please my dad, I might as well specialize in pediatrics to please myself. So that was why I studied medicine. And then now that I'm in medicine, so why am I still in medicine? I'm in medicine because in Nigeria, the truth of the matter is that it's still economically wise to study medicine. If you are going to stay in the country and you're a medical doctor, maybe you may not really hit it big, but you are not going to be poor. Okay, so you're not going to be looking for a job when you're done. You're only going to be looking for the appropriate job, the one you want. So maybe that's why I stayed in medicine, and maybe because I really don't know what else to do. Okay, so for those who don't think that medicine is their line, the earlier you leave medicine, the better. Don't get stuck. Okay, so the sixth question says that, are there any advantages or disadvantages being a female doctor in Nigeria? Does the system favor women to rise? Well, I don't think there really is any much disadvantage to being a female doctor. The only area of challenge, and I really wouldn't call it a disadvantage, is the fact that at one point in time or the other, the female doctor would have to take some time out for marriage, for having children, for nursing babies. It's a little bit more stressful. But in terms of opportunities to do things, I don't think they are really at a disadvantage. But bottom line is you have the skill, you can do it, you do it. There is no limitation to what you can do if you have the skill and the knowledge to do what you need to do. So I don't think female doctors really, the disadvantages are not different from what the general female population would experience. But I can assure you that the system doesn't favor women to rise. Everybody that needs to rise would have to work hard to rise. Women may have to work harder, but then they usually are more thorough when they get there. All right, so the seventh question says that juggling family and being a doctor. Well, that's a peculiar challenge to women because you have to settle the home while you're at work. And remember that your spouse is probably going to be working too. So, for me personally, and for a lot of my female colleagues, there are ways around it. You get nannies, you get help. Some of us were lucky by nature to have finished our family before we start residency. Children are a bit grown up, so it's not so much of a stress. But even those that are raising up babies, they find a way to cope. Fine, you might have to go for maternity leave and give extra time, before you are due for your exams. But then 6 extra months would not matter much in the scheme of things. So basically, I think those are just the little sacrifices women have to make. But it can be done if the environment itself where you're working it is not toxic and you have understanding colleagues, which usually not is always the case, but somehow people cope here in Nigeria. All right, so 3 things you need to know and work on as a young medical doctor. I'll say one thing: if you really don't want to study medicine, this is the best time for you to cut out. As in, just go and do whatever it is you want to do outside of medicine. If you want to study medicine, if you really really love to do medicine, then I would advise you that you should make up your mind the aspects of medicine you want to do first, and you should give it all your best. And then the third thing I'm going to advise is that do not let financial gains, do not let monetary gains be your driving force. Let passion drive you. Because if passion doesn't drive you, if money drives you, you are going to get the money and you're going to end up being empty. So I would advise you that look for what really, really strikes you, what lights the fire in you, and run after it. And then lastly, I don't want you to follow the crowd. All your mates might be writing plan. Be sure what you want to do. All your mates might be writing ESMLE. All your mates might just be thinking that no, I'm not going back to Nigeria. Be sure really what you want to do, because your life is going to take different turns. And if you are not convinced of the steps you are making, you will have a lot of times that you want to turn back. And remember this, that for developed countries, I don't know the statistics for Nigeria because we don't usually have statistics. But for developed countries, highest rates of depression and suicide is still among medical doctors. So the stress is everywhere. Okay, the pay is just better outside the shores of this country. So my advice to you is that go for what you want and then just do it. Bye.